First of all, I went from 7.5 hours on a bed in casualty because they were short of beds. And then I get from went to a kiddies ward, spare bed. From there, and a late afternoon, went to kidney ward for a day, and then from there to stroke at 26.
The communication group were very pleased to see the document. They felt that it was long overdue, and they were pleased to see that it addressed issues that they themselves had identified in terms of the gaps in their own pathway. They were very keen to get involved. With using supported conversation in the group, they were able to look at the document over a period of several weeks at their weekly meetings and consider it as a group together, giving their individual opinions and feelings and discussing their own individual experiences, but they were able to feed that information into the documents which were returned to the Department of Health and therefore incorporated in the final version. A speech and language therapy student who was actually working with the group on the consultation document as a conversational partner, and she said, "We learn all about stroke pathways and services, and then we come somewhere like this and find out what really happens when someone has a stroke. It's an eye-opener."
My wife spoke to me and it was just gobbledygook, just as quickly as that. And of course the hospital wasn't available then, but she got a stand-in, and she said, "Go along to hospital, but hang on till the morning."
Committed suicide, tried 2 times, and self-harmed and all. Yeah, I want more now. I want more. I want a work now or something to do. It's awful.
I transferred it after one day into the sort of stroke unit ward. I was quite well looked after in there. I had physio on several occasions and one session with a speech therapist.
Oh, we discussed it amongst ourselves, and then we realised that what we didn't have had, well, what we've missed, well, we both cheated, really cheated.
Planning groups are meeting, strategy groups are making plans for the future, looking at what they have in place already, holding mapping events, consulting service users and potential service users and carers, involving them in the process of what happens within the pathway.